Hey everybody, it's Kristen. I know I've been promising that I would make this video for a few days now, but as some of you know, I went to my surgeon appointment, surgeon and anesthesiology appointment on Friday, the 15th, and I wanted to make the video on Saturday, but that didn't really work out as planned because I hurt my back pretty bad, and I was kind of laid up. And then over the weekend, I made a trip with my husband and his family to Berlin to visit a friend, and obviously didn't have the chance to do that then. So making it now. Wanted to let you guys know that I do have a surgery date, and that is February the 24th. I'll go into the hospital in the morning the day before, and I'll check myself in, and I will be staying there overnight. And they'll do some tests. I think they're going to do an endoscopy and everything. And I don't know if they're going to do a few more things. They'll probably weigh me, maybe measure me. I don't know exactly. And then the following day on the 24th, I will have the surgery at 10:50, so that's 10 minutes before 11 in the morning. And they said it should last about 2 hours. Other than that, as far as the hospital stay goes, they said they will do like sort of like a little informational meeting about the nutrition after the surgery. I kind of know a little bit, thank you to all you guys who've talked about your after stages, after your operations with soft foods and purees and all that stuff. But they're going to tell me about that. I mean, because it's going to be a little different here. I mean, generally the food is similar in Germany, but there's kind of some different products and stuff like that, and I'll need to find a protein shake and stuff. So they'll go over all of that with me. I will probably be in a room with 2 other people, and more than that, I don't really know. At my appointment on Friday, I made a little list of questions that I would highly recommend when you go for your appointment with your surgeon after the original consult. Well, I'd also recommend that for the original consult, but I didn't talk to my actual surgeon, but I did talk to one of the surgeons there who helps with that surgery. So she answered all my questions and went over everything with me another time. And I asked about ibuprofen, but she didn't say. I mean, because I've heard from all you guys that one can't take ibuprofen after the surgery. But she said that I would be able to, so I'm still a little skeptical about that. So I asked my doctor today. I went to the doctor's today, and he said that I'm right, that I shouldn't, take it, because it's an it's an NSAID. So basically, it's an anti-inflammatory and could wreak havoc on the pouch. But what they did say is that I can't take any blood thinners like aspirin or some other things, or anything that would cause an ulcer to the stomach. In addition to that, I had an EKG to check everything with my heart, and I had some blood taken, and I had a conversation with the anesthesiologist, and she told me how everything would go. She said, obviously, I would have to come into the hospital not having eaten from the night before at midnight until, the morning and everything. And she said that in between, I would be able to take my medications. That was a question I had too, because I take a couple of different medications, metformin for my hormones, and birth control also for my cycle and everything like that. So I would, if you guys take medicines, if you haven't had the surgery yet and you're looking into it and everything, I would ask, your surgeon if you are able to, or your anesthesiologist, if you are able to take your medicines when you're in the hospital, so that it's good information to know. Let's see. The anesthesiologist told me that I would be given some sleeping medication the night before to kind of calm me down, so that I wouldn't be too excited or too nervous or anything to sleep, so that I would be comfortable and everything. And then they said that when they wake me up in the morning, they may do a couple more things or whatever, and then I will be given a tablet to make me sleep, and guess some of you guys have called it the happy pill or whatever. And then they'll insert a catheter, and then they will, once I'm sleeping, they'll do the breathing tube, and yeah, then they'll bring me to surgery, and then they'll do the surgery, and then they'll remove the catheter, and which is kind of cool that they're going to do that while I'm sleeping, because then I don't have to be awake to experience all that. I don't know if I think I mentioned at the beginning of the video, when the day that I'm admitted into the hospital, the day before the surgery, they're going to do an endoscopy, and I did ask, like, I guess in some cases they give you the chance to be sleeping or awake when you have the endoscopy, like in your throat area, and I gag very easily. Like, sometimes if I put my toothbrush too far back when I'm brushing my teeth, I gag, so I absolutely wanted to be sleeping during that. And so they do give the option to be put to sleep. So she said I won't remember anything from it, which I am totally thrilled about. Other than that, I don't have much more information, but I am getting excited and nervous, and I don't know, I guess I'm feeling kind of a mixture of things about it, but yeah, so 5 weeks from today, I will be already finished with the surgery and in recovery, so that's about it for now, and I will keep you updated as time goes on. Thanks. Talk to you guys soon.